Welcome back to Insight. We're at Goshen Center for Cancer Care with Dr. Hostetter, and we want to talk about screening, and specifically colon cancer screening, which has done so much in making this cancer just that much easier to treat, I guess.
Well, that's true. It's not done as often as it should be, though, because only about 20% of the people who should be getting it are getting it.
Well, who should be getting it?
Well, that's an interesting question. Clearly, if you're over the age of 50, you've already qualified, and Medicare and most insurances will pay for it. However, it's important to realize that both men and women are getting this disease. It's higher in men, but very, very important in women, and African Americans have a higher incidence of getting cancer as well. So really it's a disease that we need to start checking at a very early age and then a consistent age.
Now, my wife has a family history. It feels like she started at, I want to say 30, 35. If you have a family history, when do you start?
So usually you start 10 years earlier than when the index case in the family is, or if you have underlying diseases. So the interesting thing is although insurances are starting to pay for it routinely at 50, asymptomatic, in this country, people who are 40 and 30 are starting to get cancers because of having underlying risk factors that we didn't know about. So if there is something going on that isn't right, colonoscopy is really the right place to go.
Now, when you're doing that colonoscopy and checking for these colon cancers, are polyps, can I call them pre-cancer in every case, or is that just something that you kind of just go in and just before they become pre-cancer? I don't know when it becomes, it's a warning sign, I guess.
Yeah, it's a warning sign, and we do know that about 99% of cancers start as a polyp. But there are 5 different basic kinds of polyps, and not all polyps are precancerous. But removing polyps is the key to keep you from getting a cancer, so that's the starting point.
So I feel kind of like it's like the routine maintenance on my car. If you see a problem when you're testing for the cancer, something that could possibly go wrong, you go ahead and fix it right then usually, right?
Absolutely, absolutely. And it's the nice thing is this is not something like your car that you have to do every 3,000 or 5,000. It's really every 10 years in terms of routine maintenance. And so the investment of going through a day of, having to make this a priority is a pretty significant investment for what is continuing to be our number 2 killer. 50,000 Americans are dying of this disease every year, and we can put an end to that if we can get this test done.
So who do you need to talk to frequently? Is it the men that aren't coming in? Is it you need to talk to the wives saying, push the guy in? What do we need to do?
I think it's a team approach, and we've had couples both show up to get tested together. Clearly, men have a little bit of reluctance, but I think all it takes is experiencing one person with the cancer, and you then realize this is a pretty small investment. The nice thing is, nowadays colonoscopies are very, very safe. They're virtually free of discomfort because the preparations are better. The medicine you get while it's being done is so much more effective. Your ability to get up and do what you want to do and eat what you want to eat right afterwards is a pretty phenomenal investment for 10 years of a pretty deadly disease.
Yeah, if you'd like to find out more about the testing that goes on and other ways that you can learn more about how Goshen Center for Cancer Care is fighting cancer and winning that fight, you can go to their webpage. You can also call this number to make an appointment. We'll be right back on Insight.